Today we're going to talk about primitive reflexes in the newborn, and we're going to demonstrate some of those reflexes here on this newborn Robert. Robert is 1 month old. He'll be 5 weeks tomorrow. And you can see I've got Robert covered up to keep him warm for the moment, but I have him undressed down to a diaper, and that's going to be important when I'm assessing those reflexes so that I can really see the movement of his body without there being clothes in the way. Just a few general words about primitive reflexes. Primitive reflexes are involuntary movements that are present in the newborn. They originate in the lower portions of the central nervous system. So they should be present in the newborn. If we see them, that they're absent, we may be concerned about proper neurological development of those lower centers of the central nervous system. As the baby grows and develops, those reflexes should actually go away or integrate. And so if we see that those reflexes do not integrate, we may be concerned that the higher centers of the central nervous system aren't developing properly, because as those higher centers develop, baby gains the ability to voluntarily control movements, and then these reflexes should go away. And I'll talk about each individual reflex and when it should appear and integrate, but in general, we really see most of these reflexes gone by 6 months of age, and certainly by 1 year. If they don't go away, they could interfere with proper development. So the first reflex we're going to look at is the asymmetrical tonic neck reflex, or the ATNR. So Robert is sort of doing a partial ATNR right now, but what we do for that reflex is we turn the head to one side, and we see flexion of the arm on the head side and extension of the arm on the face side. And so it's also called the fencing reflex. So we'll turn to the other side. We always want to assess both sides so that we can see if there are any asymmetries, because asymmetries can be sort of a red flag. And Robert's pretty relaxed here, so there we go. There comes that reflex. So we see a little bit of extension of that arm on the face side, flexion on the head side, and again, we see that ATNR kind of kick in. This reflex usually is present at birth and integrates by about 4 to 6 months of age. If the reflex persists, it can get in the way of development of good eye-hand coordination and reaching and grasping. So the next reflex that we're going to look at is rooting. And so the rooting reflex is sort of a food-finding reflex. So I'm going to just stroke Robert's cheek here. He's not happy that I took away his pacifier. And you can see he turned his head to find that stimulus and then to suck. So we'll see if he goes to the other side. And he does. He overshot it a little bit. And that's a real classic rooting when you see that head going back and forth. And so we see that Robert has that reflex present. Most babies all should have that reflex at birth. And it usually integrates by about 3 months of age, when the baby really starts to gain good head control and doesn't need reflexive movement for food finding to find that nipple on the bottle or on mom's breast, and can really just go to it on their own. The next reflex we're going to look at are the grasping reflexes. And so I'm going to note that Robert's hands are mostly fisted, but they open a little bit. And so when they're kind of open here, I'm going to put my thumb in his palm, and you can see he's grasping me sort of rather tightly. And then we see the same thing in the feet. So if we push on the toes, we see those toes curl, or push on the ball of the foot, those toes curl pretty strongly. And so this grasping reflex in the palmar grasp usually integrates by about 4 to 7 months of age. Plantar grasp is going to integrate by about 9 to 12 months of age. And this really coincides with development of reach and grasp in the upper extremity. So if the reflex persists beyond 4 to 7 months, then the baby's going to have trouble developing the ability to voluntarily grasp and release an object. And if reflex persists past 9 to 12 months, as in terms of plantar grasp, then baby may have difficulty learning to stand and walk. Okay, so the next reflex that we're going to look at is the gallant reflex, and that reflex involves holding the baby in sort of a prone or a suspended position, and we stroke the spine, and we see here that the baby shifts his hips towards the side. So this is also sometimes called, and his is just not very strong right now. He might be a little bit young for this. Here we see it a little bit there. And there we go, back to the other side, one side, and then the other side. There we go. So that reflex sometimes is also called like the trunk incurvation, because you stroke along the side of the baby's spine and the trunk actually curves towards that side. And again, you do it in prone or a slightly suspended position, and usually you'll see those hips shifting back and forth. That reflex is going to integrate at around 3 to 6 months. And then the Moreau reflex is one that I usually save for fairly late in an assessment because it can be upsetting to the baby. It's essentially a startle reflex, and so, or the startle is actually a component of the Moreau. So what we do is we hold the baby in a seated or sort of semi-reclined position, and we drop him back, and we see the arms extend out to the side in a startle, and then they come back in toward the trunk, and then we see the cry. And so there's 3 parts to that reaction, or that reflex. Again, you drop the baby's head backwards, usually catching it in your hands, or you can put a pillow behind them so that the pillow can catch them. You see the arms extend outward in a startle, then the baby brings the arms back in and typically cries as well. And this reflex typically integrates by about 3 to 5 months, but again, we do see sometimes when even adults are under extreme stress, they're going to startle. So, but the startle shouldn't nearly be as strong after about the 3 to 5 month age range. And then finally, the last reflexes I'm going to show you are the standing and stepping. And so our newborns actually should be able to stand and bear some weight. And Robert is bearing some weight here. It's definitely on sort of a bended leg, and it's and then we're going to see maybe some stepping out of him. Let's see. If we tilt the baby forward. He's not doing very much stepping right now, which is really not that uncommon for a baby at 5 weeks. We see that newborns are going to, when placed in a standing position, they are going to bear weight and stand. And if you lean them forward slightly, they're going to do some stepping. But often by about 1 to 2 months, these reflexes begin to integrate or disappear, really simply because the baby starts to gain weight and the legs really become, and the body really become too heavy for the baby to support and for the baby to do some stepping. So at 1 to 2 months of age, it might be a little bit early for that to be gone, but not that unusual. This is a reflex that you're really, those standing and stepping, you're really going to see in those really new babies. But again, once they're, usually by about 2 months old, we see those reflexes, the standing and stepping reflexes disappear. So that's just a little bit about reflexes. Thank you, Robert, for helping us today.